The Ministry of Health, Wellness and Nutrition recently implemented the Event-Based Surveillance EBS system, which is a critical strategy to enhance the rapid detection, assessment, and response to new and emerging public health threats. In light of this, the Ministry of Health, in collaboration with the Pan American Health Organization PAHO, is conducting capacity building workshops with community focal persons and 311 call center personnel to better familiarize them with the event-based surveillance system. The first training session brought together community focal persons, which included representatives from Red Cross, National Emergency Management Organization NEMO, and community disaster groups, to name a few. Through presentations and discussions, participants learned about the identification of diseases and public health events, establishment of a community-based surveillance structure, reporting and investigating of public health events, and supervising a community-based surveillance structure. National epidemiologist Dr. Michel Fassois says it is her hope that participants will be better equipped to conduct surveillance of emerging health threats and to facilitate quicker and more effective responses in their respective communities.
These are individuals who live in the communities. They know best these communities, and so they form now part of our national surveillance system, whereby we train them, we educate them on what's happening in St. Lucia, and they in return, knowing their communities in that level of detail, they come back and let us know what is happening in their communities. They are best placed to do so. They know their communities intimately, they know their people intimately, and they are able to tell us what they are seeing on the ground. Increases in fever and rash, increases in joint pains, sudden deaths, death of animals that is unexpected. So these are the things that we are training them to look for and report to us. And in return, of course, we work closely with them, explaining to them our system and how they form part of it.
PAHO Country Program Specialist Fiona Anthony expressed appreciation for the community focal persons' engagement in this training, as they are essential part of the success of the event-based surveillance system.
I trust that you will have a rewarding, informative and enjoyable experience during this training, and we are thankful to the Ministry of Health, Wellness and Nutrition, St. Lucia, for convening this training and for leading the way regionally in events-based surveillance. PAHO remains committed to supporting the Ministry in all efforts to strengthen surveillance systems in St. Lucia.
In the coming week, 311 call center personnel will also get trained on the EBS system. The event-based surveillance system training is being funded by the Pandemic Fund project. Reporting from the Ministry of Health, Wellness and Nutrition, I am Fernell Neptune.